Welcome to CPT and HCPCS coding. As you review these slides, please have your coding books and workbook available so you can reference codes and locate key areas necessary to code properly. Going forward, please also seek reference materials such as your medical dictionary, anatomy books, and pertinent websites. The primary objective of this information is to provide a basic introduction to the format of CPT, as well as its history and CPT coding conventions. You will also demonstrate different ways to locate CPT codes through the use of the Codebooks Index and to identify ways to ensure accurate code assignment through the application of coding guidelines and understand the documentation necessary for code assignment. The workbook, CPT and HCPCS editions, are intended for students who have limited knowledge of or experience in CPT coding. The instructional materials in this workbook are not specific to any particular practice setting, as they apply to both hospital-based and office-based coding. The exercises provide hands-on experience in coding some of the more common procedures and services performed. Medical coding is the process of assigning codes, which are made up of numbers, letters, or both, to services and procedures that patients receive, and to conditions or problems that patients may have. Coding is the transformation of verbal descriptions into numbers. For example, we are very familiar with this task because we use codes every day to carry out simple business and personal transactions, such as zip codes, which transforms street addresses into numbers. CPT is copyrighted and published by the American Medical Association, known as the AMA. CPT is a uniform language for describing and reporting the professional services performed by physicians. It standardizes terms and descriptors of documented procedures in the medical record and communicates accurate information. It was developed as a method of communication between the providers and the payers, as it was intended to be used for reimbursement. This is unlike ICD-9, which is currently under the direction of the World Health Organization and uses the information to assist in tracking mortality and morbidity in order to make statistical assessments of disease trends. ICD-9 CM stands for International Classification of Diseases, Clinical Modifications, and is currently in the 9th revision. It is used to describe and report illnesses, conditions, and injuries of the patients who require medical services. It is made up of series of numerical and alphanumerical codes, which code descriptions are represented very specific illnesses and injuries. CPT nomenclature consists of descriptive terms, guidelines, and identifying codes for reporting medical services and procedures. Because the CPT is not a strict classification system, some procedures may appear in sections other than those in which they may ordinarily be classified. We must use the current CPT edition required. The new editions are used effective January 1st. The official publication is the CPT Assistant, which may be available on a HIPAA virtual lab. The purposes of coding is to permit retrieval of information for users, for research, quality studies, and administrative decisions, and as noted, it is primarily for reimbursement. It serves as a method of communication between insurance carriers and the medical professionals, which enables comparisons of reimbursement amounts, and it speeds up the processing of claims. It provides data on trending and planning. Let's review the CPT structure. Category 1. These codes describe a procedure or a service. The descriptor in this category of codes is generally based on the procedure being consistent with contemporary medical practice and widely accepted in the medical community, and thus is being performed by many physicians in a clinical setting. They are subject to a lengthy approval process conducted by the CPT editorial panel. The minimum requirement is that many healthcare professionals perform the service across the country, and the FDA approval must be documented or imminent within a CPT cycle and have proven clinical efficacy. They are generally accepted services. They are not emerging technologies, services, and procedures. Category 2 codes are optional tracking codes that have been developed principally for performance measurement. They are intended to facilitate data collection by coding certain services or tests that are agreed on as contributing to positive health outcomes and quality patient care. These codes provide options of supplying information to plans through the administrative record or billing. Category 2 codes are assigned an alpha identifier and are numeric. They end with the letter F in the last field, such as 1234F, to distinguish them from CPT Category 1 codes. They are located in a separate section of the CPT book, following the medicine section. The uses of these codes are optional and are not required for correct coding. To expedite reporting of Category 2 codes once the CPT editorial panel has approved these codes, the new added codes are made available on a semi-annual basis via electronic distribution on the AMA website. These are provided to review and to prepare for implementation on the effective date of January 1st of each year. Category 3 codes are emerging technology codes and are temporary codes. They are intended to be used for data collection purposes and to substantial widespread use of new technologies, services, and procedures, or those that are in FDA approval process. They are not intended to use if they have not been accepted by the CPT editorial panel. CPT Category 3 codes are assigned an alphanumeric identifier with the letter T in the last field, such as 1234T. These codes are located in a separate section of the CPT book following the CPT Category 2 codes section. HIPAA, or Healthcare Procedure Coding System, is also published by the AMA, but is maintained by the Centers for Medicare and Medicaid Services, known as the CMS. Its purpose is to provide a system for reporting the medical service received by Medicare beneficiaries. HCPCS is made up of 2 parts. Level 1 is composed entirely of the current version of the CPT book. HCPCS Level 2 provides codes to represent medical services that are not covered by the CPT system. For example, medical supplies and services performed by healthcare professionals who are not physicians. Level 1 CPT codes show that 80% of the HCPCS can be located in CPT. And as stated, the national codes, or Level 2, was developed by CMS to identify other services not in CPT. These include supplies such as wheelchairs, hearing aid batteries, and crutches, or injection codes which identify the actual substance such as penicillin, and also other services such as dental, chiropractic, vision, or orthotics. Here we have an example of a HCPCS Level 2 code for a splint. Code set is S8451. You will find splint in the index, and then choose the body part of ankle or wrist in the index. You will then go to the tabular and find the correct splint code selection. As mentioned before, ICD-9 is the diagnostic component. As coders, you will report the highest level of specificity of that code set. ICD-9 codes explain the reason for the encounter and then links with the procedure code for billing. If the codes do not align or are not approved, the payers may deny payment. Medicare required codes ambulatory setting. This shows that the facility and the physician will use the ICD-9 codes for the diagnoses and HCPCS for procedures. In a hospital setting, they will use a facility code, ICD-9-CM, for both diagnoses and procedures. They will also use the ICD-9 and HCPCS for physician services. As noted in the prior slide, and for your information, there is a third volume in the ICD-9 book, which is a set of procedure codes used for hospital use only. It does not nor will replace CPT codes. ICD-10 will use a different method and will build codes, so please go to CMF's website for further information on this. This slide tells us that the correct and accurate coding relies on complete documentation, correct coding, which results in appropriate reimbursement. The OBRA Act of 1986 requires CPT and HCPCS coding for federally funded patients and supports billing of services. HIPAA, or Health Insurance Portability and Accountability Act, provides standardization in claims with approval code sets. There are two approved claim forms, the CMS 1500, which is for physician services, and the CMS 1450, known as the UB04, which is used in hospitals, both in and out patient services. Diagnoses must be linked to the procedure. Here's an example of a CMS 1500 claim form. Please note box 21 allows for the diagnosis code, box 24, column D, allows for the procedure, and column E also allows for linking the diagnosis code by entering the number 1, which is the first diagnosis noted in that box, or 211.3, benign neoplasm of the colon. This ends your Chapter 1 vodcast. I hope you enjoyed the information. Thank you.